I feel really grateful to be here. I feel honestly overwhelmed. I looked at the agenda and look at the people here. So many are people that I've admired for years. And so as I was sitting here, I was thinking, well, who's the audience? And what I learned about the audience is you're super smart, incredibly insightful, and very articulate. Um, I wouldn't have minded if that discussion just kept going. So I'm going to move through my piece and hopefully continue to set the stage for Dr. Giardino, who is truly a healthcare hero for children. And we're very excited to hear from him. All right, I'm going to talk a little bit about my journey in the area as a primary care doctor. So I'm a community pediatrician, and my interface with some of the issues we've been talking about, my emphasis is going to be a lot on social drivers of health, or as Dr. Avendette said, social and political. I love that. That's good. Thanks, here. So you can go ahead and go to the next slide. I'm going to start just with a kind of a patient journey over the past decade. And so I'm going to talk about my patient now, who's a 13-year-old young man, and he's doing well in school. He has positive social interactions and friends. He's reading well above grade level, and he wants to be an engineer. And you can go to the next slide. So a decade ago, and before that, this was a 3-year-old boy with significant trauma and abuse, a lot of housing instability that's pretty recurrent. Actually, that's still kind of going on with housing instability. A lot of issues with food, parents extremely stressed, a lot of in and out mental health concerns with the parents as well. And at the time, really uncontrollable behavioral challenges. And what he wanted to be at the time is he just wanted attention. And so I look at then and I look at now and I think, okay, that's an interesting journey. And this little guy, I wish I could say his name, but I probably shouldn't do that. I've learned a lot from him and his family over the decade. So I want to talk a little bit about the tools that we've tried to build into the toolbox to interface with these drivers of health that arguably have so much more to do with their long-term health and wellness than many other things. So you can go to the next slide. One of the things that I was fortunate to come into when I became a primary care doctor was a patient-centered medical home. And in the back, Dr. Mark Briesacher was one of the ones who helped to organize that for our system. I'm very grateful for that. And as we came there, we were able to use that team. So a patient-centered medical home is more than just a doctor. You've got a team there to try and help support a child and a family. And so we, about a decade ago, we initiated work in this model called the Safe Environment for Every Kid model. And so that's a model where for young children, there's a standard set of questions that we go through at certain well visits up through age 5, and then we've adapted some things for beyond that. But it asks about things like, it starts out asking about, do you have a smoke alarm, or does anyone smoke at home? But then it gets into food insecurity, talks about parenting stresses, difficulty taking care of a child, talks about extreme stress. It asks a couple questions about the mental health of the parent or the caregiver. Then it asks questions thoughtfully and sensitively about violence in the home, intimate partner violence, as well as substance abuse in the home. And so I was, again, so fortunate to have a team that supported this, to be able to get at these questions that arguably have so much more to do with the long-term health. And so what we learned, that's how we learned those things about this cute little guy and his family, and just being able to listen to them over time, and then developing all these partnerships. Emmy's here. I haven't seen Emmy in years. Did she go? Oh, she's still here. So that's how we connected. And so many people think, okay, if we ask these questions, we need to have a perfect response. I don't agree. We need to have a response, a good response, but it can't be perfect, or we'll never do anything. And so that was a big lesson over time, just learning through these kinds of systems of developing those relationships with the home visitation, with the other things, that we're all involved with this family, this cute little guy. people also ask, I want to touch on this question really quickly as well. People ask, okay, if you're going to ask those questions, are you going to be reporting these kids more to Child Protective Services? And the reality is, it's completely opposite. When these studies were done for this model, there are actually decreased reports to Child Protective Services in the intervention arm using this model as opposed to the regular arm. And the reason is, it's a different lens. You're looking at a family and you're trying to be useful to support them. And you develop a trust and a partnership with these remarkable people. So I'll come to that in a second when I talk about his family, but it's just a different way of thinking about what we're doing. And to me, that's super exciting. All right, we can go to the next one. So I mentioned some of the trauma that he'd experienced. So we partnered with Dinah's team. Where's Dinah? She's still? Oh, just about. Okay. Anyway, the team is Safe and Healthy Families. So as we identify these things and develop these relationships, and working with the team there on a care process model related to identifying and being able to support and treat for pediatric trauma. And Dr. Giardino is going to talk more about that. But there are things we can do. So this cute little guy was connected into those services with that team, and then to subsequent follow-up, which is critical for him to be able to move forward. So that's another really important piece. You can go to the next one. This is a simple thing, but I'm guessing you're familiar with the Reach Out and Read program. This is a program where we give a children's book, appropriately aged children's book at well-child check, starting from 6 months of age up to a child's 5th well-child check. So there's like 10 opportunities through there. And this little guy, he loved books. And it's not about the book. It's about having a safe, stable, nurturing relationship. And so giving the book and modeling what it looks like to a parent to have that kind of an interaction, that's a big deal. I remember the day when he was in school. I think he was in 1st or 2nd grade. And we were following up on a mental health form because we're working through all of those things. And we got some information from the teacher. And the teacher marked that he was above average in reading. I'm not saying that's because of what we did. It's because of his family. But I just couldn't believe it. And I went and found my care manager, Tara. I'm like, Tara, look at this. Did you ever think you would see that? And we didn't think that. So behind all these evidence-based programs, there's these little kids, right? And it's so amazing to see some of those things happen. All right, we can go to the next one. This is the most important one, is his family. Some people, Dr. Abendet talked about the concept of saviorism, and I think it's probably fair to say that when I started my journey, I thought, gosh, we're going to implement Seek, we're going to help so many people. I have learned that the word help is not exactly the word that fits, for me anyway. We've developed a team and trust and resources so we can be useful for these incredibly creative people. And I think sometimes people may look from the outside and look at that family who's still struggling with employment and housing and things like this and say, that's a dysfunctional family. And I just think that is so superficial. There are times when I'd come out of that exam room with this mom, and now she's married in a stable relationship, which is really remarkable. And they have a couple other kids with special needs too, by the way, and I just shake my head in amazement about what they do. So that's come through loud and clear here today. We have nice programs. We think we know what we're doing, and we offer good things, but it's that family that he has that's his biggest resource. And they are remarkable. So, you can go to the next one. Does anybody know what that is? That elephant thing? No? Nobody? That's called the elephant of the Bastille. And Napoleon had this idea that he was going to build this ginormous elephant and bronze it, make this huge statue, right? And to kind of show the might of his empire. And the bronze statue was actually never built, but a plaster was. And it was in the early 1800s, and Victor Hugo actually writes about it in his book, Les Miserables. And it occurred to me in doing all of this work that what we're talking about today is the same thing that Victor Hugo was talking about. He published that book over 150 years ago. But that elephant is where Gavroche lived. Now, who remembers Gavroche? Okay, if you're a Les Mis person, you probably remember Gavroche. He's a street kid. And he lived in the elephant. And he actually helped a couple other kids, street kids, to find shelter in an elephant. So you can click the button. I love this little quote. Victor Hugo talked about what Napoleon's idea was for this elephant. He said, God had done a grander thing with it. He sheltered a child. And I just loved that. So again, we do lots of grand things. And it's not dissimilar to what the Ronald McDonald House vision is, I would imagine, as well. I mean, that's really what we're after in terms of supporting families and children. So he has a whole section, just for what it's worth, in the unabridged version of his book, where he talks about the street children of Paris. They're called the gamin, and you can click to the next one. That, I guess, is the word for the street children. He says, the gamin is a beauty and, at the same time, a disease of the nation, a disease that must be cured. You can click again. How? By light. Light makes whole. Light enlightens. You can click again. Give them light that they may give you warmth. I love that. I think my mission and that of our team is to unleash the joy and potential of every child. They have it in them. It's already there. And if we can give them that light, we all know they give so much more back. So there are all these factors, and it's complex. But I just am grateful for the people here and the discussions I've heard and how you've uplifted me as we continue this journey to unleash that joy and potential. So with that, I'll turn it to Dr. Giordino.